Hi there, welcome to the Renew Wales podcast, a new series of conversations with interesting and insightful people within our wider network. I'm Delyth Higgins, Communications Officer, and today I'm chatting with Claire Terry, who until very recently was one of our mentors and was hosted by Grow for It Llantrisant Community Garden. So Claire, how are you today?
Hi there, I'm good, thanks.
Excellent. Can you tell us a little bit about the profession of occupational therapy, what it entails, what you do, how long you've been doing it, that kind of thing?
Okay, yeah. So I've been an occupational therapist since the year 2000, so it's my 20th anniversary this year. It's an allied health profession, so we tend to work in health settings, but also in social care settings. And it's a profession which is, our work is aimed at increasing people's independence in the tasks that they need to do in their daily lives. So I spent a lot of my professional career working within the NHS in settings where I was involved in rehabilitation for people after surgery or after stroke or after a health condition which had caused them to be an inpatient. I've also worked in the community settings, so visiting people in their houses and addressing needs, like stairs and ramping, and adapting the house to make people's function better within their home environment. I left the NHS a few years ago and started working with people doing outdoor health and wellbeing sessions. So I've been working in garden settings, and there's a lot of crossover with my skills as an occupational therapist, in that you can do a lot of activities that you might have been working on in a hospital, you can do in a garden setting. Obviously being outdoors, you've got the added bonus of people benefiting from nature as well.
Definitely. So how did your interest in sort of environmental issues and sustainability, climate change issues come around? Is it something you've always been interested in, concerned about, or has it been a bit more recent?
Well, I'm a person who loves the outdoors myself. I like walking, I like nature, I like gardening. I became a community gardener about 5 or 6 years ago, and sort of co-founded the Llantrisant Community Garden, and we became involved a bit with Renew and learning about how our garden setting could be sustainable and not having too heavy an impact on the world that we're living in. So it's probably through my community gardening mostly that I've become more aware and been learning more about it.
Okay, is that quite a small, did it start off as a small group of interested people and has now, flourished with lots more people involved, or is it still quite small, varied people of all ages?
It is quite small. Initially it was a group of us who were parents largely, okay, wanting to do those kind of activities together with our children. Our group has gone through a series of changes in our locations and in our sort of makeup. So at the moment we don't actually have garden setting, but we're working on having a license to use a piece of woodland in Llantrisant, to become more sort of woodland and nature based than actually garden and horticulture based. But as a group we've had to sort of roll with the changes that have happened even before COVID. But that's part of life, adapting and changing and making the most of what you can.
Definitely, and that happens a lot in third sector and community groups as well, doesn't it?
Yeah.
So quite a while back now, you attended on our behalf a Public Health Wales workshop, which was all about carrying out a health impact assessment following the Welsh Government's decision to declare a climate emergency. Now, there were lots of different types of people there: environmental scientists, researchers into climate change, emergency planners. policy managers, representatives from NRW. How did you feel that session went? How did you feel as a member of the community, if you like, even with your professional hat on as well? How did you feel that event went, and what was your experience of it?
Well, it happened at a really interesting time. I think was it back in February or beginning of March? And it was just after Wales had experienced the floods that we had at the beginning of the year. My own area where I live, Rhondda and Taff, was badly affected, but there were also people there from other areas in Wales which had been severely impacted by it. So it was very fresh in our minds, this very tangible example of what climate change was meaning for us. And like you say, there was such a range of people there that were able to speak from their own examples. And I was very aware from my community how people, community gardens were being washed away, people's houses were being flooded. From my experience as a healthcare worker in a geographically challenging area already, I know that it's really hard for community services to carry on running, and home care and health visiting and all the people who would go to people's houses. If the roads are all closed down, if the infrastructure is impacted by the environmental events, it makes it really hard to deliver services to people, and communities which might already be quite isolated are then even more isolated. So yeah, we didn't realise at the time that COVID was just around the corner, and things were going to change even more. And whether COVID has some element of it which is through environmental change as well, people living in areas which perhaps humans wouldn't have populated before. It's hard to know whether that's got an impact as well, but yeah, we're very much living through it at the minute.
Definitely, yeah. You've said that sort of bringing climate change into the picture changed your outlook and brought a new perspective on your work as an occupational therapist. Can you say what you sort of mean like that, by that, sorry, and what difference you think it made to how you carried out the role?
I think, certainly with the area that I live in, when we look at somebody's function in their own home environment, we were already coping with things like people live on very steep hills. It's not always easy for people to walk to a shop to get their milk. And, when you add in the fact that people couldn't leave their homes to go and get some food, and how were people going to live their lives when, things had been so disrupted. And, sort of following on from that with the COVID aspect, people's daily routines have been completely turned on their heads. All the things, the social networks that people relied on, the groups that they went to, the activities they would do in a week to keep you feeling, on top of the world and tickety-boo, they were ripped out from under people's feet. And climate change, whether it's the flood or whether it's COVID, people's lives get turned upside down. And, sort of now we're 6 months on from COVID happening, and we're probably, 8 or 9 months on from the flood. People are trying to piece their lives back together again, but the problems haven't stopped happening. So, it's been really eye-opening.
Yeah, and do you think that there's a change in people's attitude then to sort of realise that these are not once in a lifetime events or things that, will hardly ever happen, and that they could be facing issues and the effects of climate change, especially in your area, probably once a year, maybe longer than that, more than that. Do you think that's something that people have realised, or are people sort of still not acknowledging that?
I think people are, in a lot of cases, still in the kind of survival mode and just trying to get day to day. there was a lot of realisation sort of further north up in the Rhondda valleys, where deforestation had happened, that plantations had been cleared, and it was very tangible that the rainwater had nothing to stop it, and it pours off the hills into blocked culverts and then floods your house. It was very kind of plain for people to see. Whether people feel that they've got the control to be able to have an impact on that kind of thing, I'm not sure. There's been a big rise in the population where I live in things like zero waste stores, and even sort of, you know, other services that are related. Obviously, physically going to shops has not been quite the same as it used to either.
No, not at all.
There's been quite a big surge in those kind of services where you can go and, you know, buy things without bringing all the plastic back home, and that kind of thing has become much more popular around in the last sort of year. So I think there is a rising awareness that people need to do what they can, even if it's a very small step, because it would help to contribute, hopefully, in the end.
Yeah, that's interesting. You know, sort of going back to the occupational therapy a minute, were you able to sort of share some of your thoughts after being at this event with sort of colleagues and other people that you met on a professional basis, as in to try and get them to think or realise perhaps that climate change would have an impact on how that role as a professional would be carried out, maybe?
I have within sort of local occupational therapy networks in South Wales. I'm also on sort of several groups as a outdoor occupational therapist, a sort of outdoor health and well-being hat, in talking about that sort of work and how beneficial it is for people, but also how beneficial it is for the environment to have people who understand what's happening and realise that they're a part of that. You know, we're all a piece of what's happening, and little changes that we make can help. But yeah, I think in South Wales people have always been quite, you know, because like I say, the environment is quite challenging in the valleys particularly. People are quite aware of you know, how things can get impacted quite quickly in delivering services, and, you know, like I say, going to homes in inaccessible areas or places that get cut off when the weather throws its best at us.
Hopefully it's something that maybe service providers and practitioners have become a lot more aware of and are planning for, and are trying to alleviate some of those issues in their day-to-day work so that the services can carry on and be provided.
I think things like COVID happening as well, it made people think of alternative ways to deliver their services. So whereas people might have physically driven from house to house to house, they'll do things like we do with Zooming or phoning, and perhaps that will have some impact on whether people physically need to travel to things, to, you know, within organisations, or whether you can do things using technology. And, you know, people are considering, well, can you work at home rather than having this building which you're heating and pumping light and electricity into? So, you know, I think in some ways, some of the things that COVID has done to us, there should be some positives that can come out of it as well.
Yeah, lovely. Thanks, Claire. It's been really interesting chatting to you, and it's a really good start to this series, which we hope will carry on and we'll be able to speak to lots more interesting people. So thank you very much for your time.
Lovely. Thank you. Ta-ra.